All right, have you thought about breast augmentation? Or even if you haven't, this is still interesting stuff. Dr. Anthony Youn, Beaumont plastic surgeon, joining us on the big round couch. Thanks for being here, Dr. Youn.
Tina.
So, first of all, is it still one of the top procedures that you're doing, that everybody's doing?
Yeah, so breast augmentation last year, according to the American Society of Plastic Surgeons, the #1 plastic surgery. Over 300,000 women underwent this surgery.
No kidding.
So it's huge.
And
forgive the pun.
Who's having it done? Is it women of all ages? Is it mommy makeovers?
Yeah, it's really a variety. And typically I see three groups. I see women who are younger and they're maybe in their 20s and they just saved up enough money now. They're finally going to do it. There are women who have had children and they use implants to kind of give them the breasts that they used to have.
Yeah.
And then I see some divorcees, people who are 40s, 50s, and their life is changing and they say, you know what, I've always wanted these. Now's the time to do it.
I need a new set.
Exactly.
I'm getting a new man. I need a new set. All right. So first of all, let's talk about the big difference between saline and silicone. Is there a big difference?
There is.
So what do we have?
So this is a saline implant, and the idea behind saline is just filled with salt water. And so it's for people who are worried about the silicone, and we can talk about silicone in a second. They don't look or feel as natural though. So if you take a feel, it does feel a little bit like a fancy water balloon. But the good thing about saline is even though it doesn't look or feel as natural, you never worry about it. 100% you'll know if it's broken. If it breaks within a day or two, you'll know because your breast will deflate and you say, oh, it's broken. And it's just sterile salt water in it, very safe.
How often do they break?
Well, we average about 1% a year. They do have a 10-year warranty. Like a car, you know, if it breaks within the first 10 years, the company will give you money actually to help pay for surgery and a free pair of implants.
Okay. All right. And these are actual implants that are used. I mean, these are... they've never been used in anybody before. Right.
But yes, these are bona fide actual implants. And this is a silicone. The idea behind silicones, it looks and feels more natural than saline. But there still is that silicone controversy. Even though science has shown no adverse effects of these implants, there are people still who are afraid of them.
So, yeah, they were taken off the market for a while.
Yes.
Why?
So in 1992, the FDA actually banned the use of silicone because there was this fear that they were causing people to get sick.
Yeah.
There was liquid silicone inside that when they would break, they would leak out. But all the subsequent studies, however, show that the implants are not connected with breast cancer or arthritis or lupus or any of these diseases. So in November of 2006, the FDA lifted the ban on them, and now we're using them again. And science has shown that they're safe, they're effective, and about 75% of women now are picking silicone.
And they pick it because it feels more natural?
Yes, feels and looks much more natural than silicone. And then the newest kind are the gummy bear implants. And these are just FDA approved by a company called Silicone, not being used a lot just yet. It's a thicker implant, and the silicone inside it much firmer. It's a firmer breast than that you would get than with the other implants.
Yeah, that seems like a lot to be, I don't know.
It's used much more now in reconstruction, so women who have had breast cancer, this is a good type of implant for those types of women.
All right, let's talk size. So here we have a very large implant, and we can show some pictures too of some women who have had implants, but that's about as big as you can go,
So this is a 700. They make it up to 800. This is actually the size that Heidi Montag had put into her. A tiny little gal. This is massive.
Yeah.
And you can contrast that to this, which is 200 cc's, one of the smallest implants that we make, and really you can see not one size fits all.
And do you advise women on size when they come in, or is that their choice, or what do you do?
It really is. Now, I kind of help them to make the decision. We use sizer implants. We use 3D imaging, actually, to give patients a way to see how they might look with different sizes. But in the end, that's the big thing. Back in the past, surgeons would say, oh, let me choose for you. I'll make you look good. Today, patients are actually taking the matters in their own hands, and they can actually choose what size they want to be. And I think that's the best way to do it.
Now, Pamela Anderson, who we're looking at right now, she has, it seems like at one point she took them out, then she put them back in, and which I guess to some extent is normal, but you do have to change them every, what, decade or so, or 2 decades, Dr.
Yeah, they typically now have this 10-year warranty, so you should hope that you don't have to switch them out within the first 10 years. But to expect more than 15 or 20 years out of them is probably unrealistic.
What happens? They deflate a little bit, or they...
yeah, the saline implants, they can break, and literally a day or two later, your breast is gone.
Yeah.
The silicone implants are much hard to tell, and so sometimes you need MRI exams to actually tell if they're broken. So every 15 to 20 years, it's a consideration, even if your breasts look good, to potentially switch them out.
All right. And when we talk about this surgery, one of the things we always talk about, you want to look for a board-certified plastic surgeon.
Yes. So a board-certified plastic surgeon who has privileges in a hospital to perform this procedure, like Beaumont, where I operate. There are a lot of cosmetic surgeons, people who aren't even trained in this procedure, doing it because it's a huge money-making operation.
Yeah, I mean, you see all kinds of ads and
the key
sales.
is if hospitals will actually vet surgeons for you. If your hospital allows this surgeon to perform a breast augmentation there, then you know that it's probably safe and it's a good surgeon with the right credentials.
And as we put up the information earlier, but you should know that this is some serious surgery.
Exactly. Yeah. No. There are complications associated with it. Yeah. And also be careful too. If you meet a surgeon and say, "Oh, I'll do your surgery in 20 minutes," you can be sure that they're not sitting you out. They're not making sure they look nice and even for you in that quick of a time.
All right.
So
and
make sure they take their time with the surgery.
Just real quick, what's the biggest mistakes that you have to fix sometimes with these surgeries?
The biggest mistake that we see, honestly, is size. You know, is women who say, "Yeah, I asked for a C and I woke up with a double D." I mean, it's the horrifying thing of you think you're going to get a Holly Berry and you wake up with a Pam Anderson. So to make sure that you tell them exactly what size you want and that you trust the surgeon, they're going to give that to you.
All right, very good. Good stuff, Dr. Youn. I know this is a popular time when people start using their vacation time around the holidays. They go in, they get a little tune-up, right?
Yeah, exactly. It's a busy time.
Thank you.
Thank you.
We'll be back after this.